Is this you first thing in the morning when you get up out of bed, or does your heel kill you if you sit for a while then go to get up? Well, you could have what's called plantar fasciitis, and I'm going to explain what it is in this video and how important it is to treat early on before it becomes chronic and very difficult to treat. So hang with me and I'll share that with you. Hi, I'm Dr. Gaffney from Dr. Gaffney Best Foot, saving you time and money in your foot care decisions. So plantar fasciitis is so important to treat early on before it becomes chronic and relenting. And I'm going to give you 5 ways to do that if you have plantar fasciitis for less than 3 months. And it's very important to go and get a proper diagnosis because heel pain can be caused from all sorts of different things. So go get a proper diagnosis first. So plantar fasciitis is a tight strained ligament that is caused from overuse and under support. And so the ligament goes from the ball of your foot and makes a long skinny triangle to your heel bone. So there's a lot of tension at your heel bone, and you can get little micro tears in there when that ligament gets stressed and then inflammation comes in, and it kind of goes on until it gets treated. So the first thing that should be done when you have acute onset plantar fasciitis of less than 3 months is stretch and stretch a lot. So what you do, you get a belt and you can loop it around the ball of your foot like this. You can also use a towel and you pull back on the ball of your foot and with your knees straight, and you want to try to work up to bending your ankle past 90 degrees like this. If it hurts to go that far, just hold it here where it's not hurting. And you want to hold it maybe about 10 to 20 seconds and do like 3 sets of 10 and do that at least twice a day. So another stretch I really like is the wall stretch, and it's good for people that can't hold on to that belt. So what you can do is you put your foot like up against the wall, the ball of your foot with your heel down, and then make sure your knee is straight again, and then just bring your body into the wall. Again, if it's hurting to go that far, you can back off, and then as you get limbered up, you can push up against the wall and get more of a stretch. If this is too much for you, you can always just take this foot and put it behind you with your knees straight and just kind of lean into the wall. That's a more gentle stretch to do that way. Okay, the last stretch that is really good is a stair stretch. So you just get up onto the stair, put the ball of the foot on the edge of the stair, make sure you're holding on to something so you don't fall, and then just slowly put your heels down, hold it for about 10 seconds there. You can even go, if you want to strengthen your Achilles and your muscles in the back, you can go up and hold it and then back down. But the stretch going down like this is important to stretch your Achilles as well as your plantar fascia. Next, for morning pain, I have my patients get a night splint, and I'll have a link for one of those in the description. And that just holds that foot at 90 degrees all night long and lets that ligament stretch out. So first thing in the morning when you get up out of bed, you're not limping. It works great for morning pain. And also, if you'd like to know a morning protocol for plantar fasciitis, check out this video here for that. The next thing that's very important for acute onset plantar fasciitis is constant support, even around the house. So I have my patients get like a slide-on sneaker, like a New Balance, Easy Spirit, take the insole out and slide and over the counter orthotic, like a Spenco orthotic. And I'll have a link to in the description on the Spenco orthotic and how to mold the Spenco orthotics. I did a video on that as well if you want to check that out. You don't even really need early on an orthotic per se, just like that constant support around the house should be enough for most people. Or you can get like a Birkenstock sandal and just wear that around the house for your support. And that strained ligament needs that support to get well. And so that's the purpose of that. If you can't, sometimes it's so inflamed you can't tolerate any pressure down there on your heels. So if that's the case, I would have my patients do their own arch strapping. I did a video on how to do your own arch strapping, so check that out. Number 4, if you're very inflamed, I recommend to my patients to get Voltaren gel. It's an over-the-counter anti-inflammatory gel. It's marvelous. And you just put it on the heel a couple times a day. It'll penetrate the soft tissues and get to the inflammation and help you to feel better. And you don't want to use this if you're allergic at all to any anti-inflammatory medication or if you have other contraindications. So check with your doctor first on that. And lastly, I usually recommend to my patients to strengthen their intrinsic muscles in their foot. So that's up into the plantar vault and the arch, and that'll take the stress and strain off of the long ligament to your heel bone and offload it and kind of build up your own intrinsic arch support inside your foot. Finally, as a precaution, just be careful when you start searching for plantar fasciitis relief online, because there's all kinds of different ways that people are treating it, and to not get tempted to buy a program or a device, I would say please check out scientific evidence for whatever the product is on ChatGPT or Consensus to find out if there's any scientific evidence for any type of protocol for plantar fasciitis before you go ahead and buy it. So now you have the tools to get it well. I really urge you to do these things daily, because in under a month it will feel better, and then just keep up that support so it doesn't come back, and maybe stretch once a day and you should be good. If you've gained some weight, try to get that off, because weight gain is a big cause of getting plantar fasciitis, weight gain in a short amount of time. And make sure you do not wear worn out shoes, because worn out shoes can also cause plantar fasciitis. If you do have chronic plantar fasciitis, so plantar fasciitis that's been around 3 to 6 months, longer, years, check out my episodes on how to treat that. And I have 2 more episodes on this. So thanks for watching, and here's your best foot forward. We'll see you again next time.
Please see the full disclaimer in the description. This is not a doctor-patient relationship. This does not constitute medical advice, but is for informational purposes only.